So first I'm gonna knock on the patient's door, and then I will go to the sink and wash my hands. And then after washing my hands, I will go to the patient and I will introduce myself. I will say, "Hi, my name is Adrian. I will be your nurse today. Do you mind if I do a 30-minute assessment on you?" Yes? Okay, perfect. Let's get started. So first I'm gonna ask you for your name and date of birth, please. Can you give that to me? Okay, sounds good, Mr. Smith. I'm just gonna identify name and date of birth on your identification band. Perfect. So the age matches the patient's appearance. I can see that the patient is relaxed in bed. I can see that there's any signs of distress, and I can tell that the patient's behavior is appropriate. Now I will assess the patient's level of consciousness. So I will ask the patient for his name for person, and then I will ask the patient what month it is for time. I will ask the patient where he is for place, and then I will ask the patient if he knows why he's here for situation. So after I've done this, I can tell that my patient is alert and orientated ×4. His speech is clear and fluid when speaking with me. Now I will do the grooming aspect for the patient. I can see that the patient's hair has just been combed. I can see that the patient is freshly showered. He's been changed and dressed. I can see that the patient's teeth have been washed. And then I can also see that the patient's nails have been trimmed and they are clean. So now after doing this, I will assess the patient's posture. So I can see that the patient's lying in bed symmetrically. There's no abnormal movements that I see. The patient's mobility in bed and getting out of bed is good. And the patient doesn't use any assistive devices. So after I've done my survey, I will pull down the gown and I will leave his chest exposed. Now I will do the vital signs on the patient. So first, I will start by doing the apical pulse. So I'm going to go on the left side of the sternum and the 5th intercostal space mid-clavicular line. I'm going to listen to the apical pulse for a full minute, listening for rate, rhythm, and force. So the rate is 74, the rhythm is regular, and the force is +2. Good, apical pulse is good. Now I'm going to assess the patient's radial pulses. So I'm going to check these bilaterally. I'm going to hold them both at the same time. Again, assessing for rate, rhythm, and force. The rate is 74, the rhythm is regular, and the force is +2. And now, after checking the radial pulses, I will now assess the patient's respiratory rate. So I will place my hands on the patient's chest, looking for the rise and fall of the patient's chest, counting each rise and fall as one respiration. So I'll put that on. So the patient's respiration rate is 16. The rhythm is regular, and I can tell the patient's SpO2 levels are 98% on room air. So after I've done this, I will now do the patient's blood pressure. So I'll go on this arm where the blood pressure cuff is. I'm going to make sure that the blood pressure cuff is on the upper arm, leaving his brachial artery exposed. So I'll put my stethoscope on. I'm going to put it on the brachial artery, and then I will look for the systolic and diastolic number. So for the blood pressure, I got 120/80, which is really good. And finally, I'm going to check the patient's temperature. So I'm going to check his temperature orally. So his temperature orally was 98.2. I would not check the patient's temperature orally if the patient has any mouth sores, if the patient has drank anything hot or cold recently, or if the patient has smoked or has had any oral surgeries. And then I would not do a rectal temperature if the patient is immunocompromised, if it's a cardiac patient, if the patient's a newborn, if the patient's at bleeding risk, or if he's had any rectal surgeries recently. And then finally, I will not check the tympanic temperature if the patient's tympanic membrane is scarred or if there's any inflammation in the ear. Now after doing this, I will now assess the head, and I can see that the head shape is normal cephalic. And moving down, I can see that the patient's facial features his color matches his ethnicity. And I can see that the facial features are symmetrical. I can see this when he's speaking to me. His mouth is moving up and down bilaterally. And now assessing the patient's lips, I can see that the patient's lips are pink and moist. There's no dryness or cracking on the lips or anything like that. So that's good. And now I will assess the patient's scalp. So I will assess the patient's scalp, making sure that the hair is evenly distributed, making sure there's no patches of hair, checking for any parasites or lesions, and I don't see any. And now I will palpate the actual head, checking for any masses, tenderness, lumps, lesions, anything like that, which I don't feel any of. That's good. So now after I've done this, I will move to the patient's neck, and I can see that the patient's neck is symmetrical. I can see that the patient's shoulders are even. You can see that his trachea and substernal notch are midline. And now after doing this, I will assess the patient's carotid artery, and I will do this one at a time to make sure that there's enough oxygen in the patient's going to the patient's brain. So I will assess for rate, rhythm, and force. So the rate is 74, the rhythm is regular, and the force is +2. And then obviously I would do the same exact thing on the other side, other carotid artery on the right side. So after assessing the cardiac, after this, I will now check the patient's lymph nodes. So I will go to the patient. I will first start with pre-auricular. I will go to post-auricular, behind the ears, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and then subclavicular right here. Now that I've finished this, I will now begin with the eye assessment. So first, I can see that the patient's eyes are symmetrical. I can see that the eyebrows are present, the eyelashes are present. I can tell when looking inside the eye, the sclera is white and not yellow or have any redness around it. I can see that there's no lacrimal damage or graynage. Finally, pulling down the conjunctiva, I can see that it is pink and healthy, which is good. And now I will do the Parla test on you. So it's checking if your pupils are equal, round, and reactive to light, and accommodating. So first I'm going to start by shining this light in your right eye. I'm going to check if it constricts. Okay. And now I'm going to shine the light in the same exact eye, but looking at the other eye now, making sure that they constrict bilaterally, which they do. So the pupils are equal, round, and reactive to light. And now I will do my accommodating test on the patient. So I'm going to bring it close to the patient. Okay, perfect. So my patient is accommodating to my pen light. And now finally I will do some extraocular movements. So I will go right, side. Okay, perfect. There's no extraocular movements. Now after the eyes, I'm going to move to the patient's ears. So I'm going to tug on the tragus to make sure the patient has no pain when I do so. I can see that the tragus is not inflamed, it's not red, and everything is good with it. The patient says there's no pain. And now I will pull on the lobule, again assessing for the pain, asking the patient, do you feel any pain when I do so? And the patient tells me there's no pain. I can assess the lobule, I can see that there's no redness, no swelling, no cuts or anything like that. And now finally I will assess the entire auricle. So I will see that there's no cuts, lesions, bruises, scrapes, anything like that, no inflammation going on, which is good. Now I will do a hearing test on you, Mr. Smith, if that's all right. So I'm going to hold one ear closed. I'm going to hold one ear closed, and then I'm going to whisper to the patient, and I'm going to see if he can hear me. I would obviously be on his right side if I'm doing his, or left side if I'm doing his left ear, right side if I'm doing his right ear. If I'm doing his right ear, I would say 1, 2, 3. And then I would see if Mr. Smith can repeat that back to me. If he's able to do so, which he is, then that is good, and his hearing is good. So the patient's hearing is good. Now I'm going to move to the patient's nose. I can see that the patient's nose is midline. I can see that the septum is symmetrical. And looking inside of the mucous membranes are pink and moist inside of the nose. Good. And now I'm going to check the patient's patency. So I will hold one nostril closed, assessing if he can breathe through one nostril or not, which he is able to do so. Now I'm going to close the other nostril again assessing if he's able to breathe through one nostril, and he is able to. And now I'll move away and I will assess the patient breathing. I will look for any nasal flaring, which I don't see any of, so that is good. And finally, I am going to do the mouth assessment. So I'll ask the patient to open his mouth, stick his tongue out. I can see first off that the uvula is midline. I can see that there's no inflamed tonsils or anything like that. I can see that the buccal and sublingual mucosa are pink and moist. I can also see that the hard and soft palate are intact. And finally, I can see that the patient's teeth are intact. There's no dentures, no decay, no loose teeth. And finally, I can also assess the patient's gums. I can see that they're healthy in color, pink and moist, which is good. So now finally, I'm going to assess the range of motion for my patient. So I'm going to ask my patient if he can take his chin to his right shoulder, chin to your left shoulder, forehead up to the ceiling, and then chin to your chest. So after the patient has performed these, I can see that he's done so without any trouble. And now I will apply resistance to the patient. So again, patient, can you move your chin to your left shoulder? Good. Patient, can you move your chin to your right shoulder? Good. Patient, can you bring your forehead to the ceiling? Good. And finally, can you bring your chin to your chest? Perfect. So now that I've finished this, I will now move on to the respiratory assessment and cardiac. So I can see that my patient predominantly breathes through his nose, and that's his main way of breathing. After this, I will pull down your gown a little bit, if that's all right, Mr. Smith. All right, thank you. And now I'm going to be assessing for any retractions or accessory muscle movements. So I can see that there's no retractions or accessory muscle movements anywhere, which is good. And after this, I will now roll the gown back up. And I will ask the patient, are you able to breathe in an upright position? Are you able to breathe lying down? And are you able to breathe lying on your stomach? Okay, perfect. So my patient is able to breathe in prone, supine, and upright position. And now I will ask the patient if he has had any cough or sputum recently. And he tells me that he has not, which is good. So now I will make sure to be on the patient's right side. I'm going to assess for jugular vein distension. So I'm going to lower the head of the bed a little bit. And I'm going to assess the jugular veins here. I'm going to make sure, I'm going to see if I see any protruding veins, which I do not. So his veins are smooth and flat with no JVD present. And now after I've done this, I will now move to the chest symmetry. So on inhalation and exhalation, I can see that the chest is symmetrical. The configuration of the chest is at a 2-to-1 ratio. And then I can, after this, I will check the patient's extremities. So I'm going to be assessing for any scars, lesions, making sure the color of the skin is good and matches his ethnicity. And again, making sure that there's also hair on the skin. So assessing it, I can see hair is present, no abrasions, no cuts or anything like that. You can see here, there are also cuts, no abrasions. I'm also assessing for muscle tone here, making sure everything is good. So everything looks great. And now I will go to palpating the patient. So I'm going to move down his gown. I'm going to palpate the patient's chest. And I'm going to do this posteriorly, anteriorly, and laterally. I will do this posteriorly, anteriorly, and laterally. And I'm going to be checking for any masses, lumps, tenderness, or crepitus. And then I will, which I don't see any of. And now after this, I will palpate the 5 cardiac landmarks. So I will go and I will go to the left side of the sternum, or right side of the sternum and the aortic valve, then move across to the left side of the sternum, which is the pulmonary valve. And I would go to Erb's point in the 3rd intercostal space. And then I would go to the 4th intercostal space, which is the tricuspid valve. And finally, the 5th intercostal space, which is the mitral valve in the midclavicular line. So once I'm done palpating the chest, I will now move to the patient's xiphoid process, and I will put my hands here, checking for the inhalation or respiration, making sure that it is symmetrical and the chest is moving appropriately. Good. Now after I've done this, I will check the patient's peripheral pulses. So I will check the patient's radial pulses, checking them bilaterally, listening for rate, rhythm, and force. Rate is 74, rhythm is regular, and force is +2. Good. Now I'm going to go to the femoral artery, checking for rate, rhythm, and force. Rate is 74, rhythm is regular, and force is +2. Good. Now I will check the popliteal arteries behind the knee, listening for rate, rhythm, and force. Rate is 74, rhythm is regular, and force is +2. Now I will go to the posterior tibial arteries, assessing for rate, rhythm, and force again. So the rate is 74, rhythm is regular, and force is +2. And finally, the dorsalis pedis artery. The rate is 74, the rhythm is regular, and the force is +2. So after checking the peripheral pulses, I will now assess my patient's skin temperature. So I will touch the patient's skin. I will make sure that the patient is warm to the touch and not cool, which he is, so that's good. His body temperature is good. And now after I finish my palpation, I will now auscultate, if that's all right with you. So I will lower your gown and I will listen to your lobe sounds. So starting on the right side of the sternum, on the second intercostal space. Take a deep breath in for me and out. Good. Now across to the left side of the sternum, second intercostal space. Breathe in, out. Good. Now I'd go down using the ladder technique. In and out. And out. Out. While doing so, I'm also listening to all 5 of the lobes, making sure I don't hear any crackles or wheezes, which I do not hear. Okay, perfect. So all the lung sounds in all 5 of the lobes were good and normal, and I can tell that they were normal, and I can tell that there were no wheezes or crackles present. And I would also perform the same assessment I just did on the patient posteriorly, anteriorly, and laterally as well. And now I will listen to the patient's cardiac landmarks. So again, I will put on my stethoscope. And then I will start at the right side of the sternum, second intercostal space. This is the aortic valve. Now I'll move across to the left side of the sternum, second intercostal space, which is the pulmonary valve. Now I'm going to move to the third intercostal space, which is Erb's point. I have fourth intercostal space, which is the tricuspid valve. And finally, the fifth intercostal space, midclavicular line, is the mitral valve. So all the heart sounds sounded great. I didn't hear any murmurs or anything like that, so that is good. And now after I have finished my respiratory assessment, I will now move to your abdomen, Mr. Smith, so is it all right if I move your gown up? Okay. So now moving to the abdomen, again, assessing his color. I can see that the patient's color matches his ethnicity. I can see that the patient's abdomen is symmetrical. You can also see that the umbilicus is midline. And then I can also see that there are no pulsations, no striae, no petechiae, no lumps or masses as well. And after I've done this now, I will listen to all 4 quadrants of the abdomen, starting at the right lower quadrant, listening to all 4 quadrants for a full minute. So the right lower quadrant is normal and has active vowel sounds. Right upper quadrant, normal and active vowel sounds. Moving to the left upper quadrant, they are normal and active vowel sounds. And the left lower quadrant, normal and active vowel sounds. Good. So the vowel sounds are normal and active in all 4 quadrants. And now finally, I'm going to palpate the abdomen in a nice soft circular motion, checking for any lumps, masses, or distension in the stomach, which I don't feel any of. So that is good. Now I will roll down the gown over the abdomen, moving to the patient's genitals. I can see that the patient's genitals match the color of the patient's ethnicity. I can see that there are no crusts, lesions, bruises, or anything like that. The patient's skin is intact, and I can see that there is no discharge present. finally, I can see that the patient's urine color is yellow and clear, and then I can also see that the patient's stool is brown and formed. So now that I have finished my assessment on your abdomen and genitals, I will now move to the musculoskeletal assessment. So I will first start off by checking the patient's skin and texture. So I'm going to inspect the patient's skin, looking for making sure the muscle tone is good, checking for hair, making sure that there are no cuts or anything like that. It's good. You can see that there are no cuts here either. It's good. And then finally, I will assess for capillary refill in all fingernails, making sure that it is less than 3 seconds. Again, doing this, making sure to check the nails as well, making sure the nail beds are clean and trimmed. And again, making sure that there's no abrasions or any cuts or scrapes or bruises or anything like that. Now I'll move to the toes, assess for capillary refill. Again, making sure that it's less than 3 seconds. Refill, less than 3 seconds. Okay, so all fingers and toes have good capillary refill under 3 seconds. Now, after I've done this, I will ask my patient to get up out of bed so that I can observe his gait. I will have the patient walk 10 feet across the room, 10 feet back, and making sure to check for any spasticity, tics, tremors, or evenness. So I can see that while walking, my patient was even, he did not stumble or lose balance in any kind of way, which is good. So his gait test was very good. And now I will assess his Rodenberg test. So I will have the patient spread his feet shoulder width apart, and then I will have the patient close his eyes, and then I will be seeing if the patient tips over, has any unsteadiness or anything like that in his balance, which my patient did not. So that's good. And now I will assess the patient's sensations. So either with a cotton ball, I can do it on the patient's leg, and then I would ask the patient if he felt the sensation and where he felt it. Or I could take a Q-tip and I can rub it on the patient's arm here, or on the patient's hand. So I'd rub it across. Obviously, the patient would have his eyes closed. He would have to tell me where he felt the sensation. And the patient has identified that he felt the sensations in his legs and arms, which is good. And now after I've done this, I will palpate the patient's skin. And now palpating the patient's skin, I'm going to be assessing for any swelling, any edema, anything like that. Again, making sure to check for muscle tone. So I can see by assessing the arm here, there's no cuts, no edema, no swelling, no bruising, no inflammation, nothing like that. And now moving down to the extremities, I can feel that there's also no tenderness, no masses, no lumps, no bumps. Moving down, I would check for any, again, abrasions, lumps, bumps, and finally on the bony prominences, check for any edema, pressing down, checking for the rise of the edema, which my patient has no edema present, which is good. And now I will go to the patient's hands. I will have the patient grab my hands, and then I will have him squeeze at the same time. And I'm doing this to assess the patient's strength in his hands. So the patient has great strength in his hands. He was able to squeeze mine very well. And now I will move to the feet. So I will assess for his foot strength. I will ask the patient, can you press down on my hands like you're pressing down on a gas pedal? Perfect. And then can you bring your toes to your head, please? Okay, great job. So now I will perform some range of motion exercises with you. First, we're going to start off with pronation, supination, flexion, extension, abduction, adduction, and then circumduction. Okay, perfect. So that finishes my assessment here today, Mr. Smith. Is there anything else that you would need? No? Okay, perfect. Your call light is right there. If you need anything, just click it and I will be here to help you. Thank you.